Okay, now let's see some important MCQ questions that are usually asked. One is regarding the joint space. So, which is the which is the synovial space or joint space that normally communicates? Synovial space in the wrist or the hand, the space that normally communicates. Which one is it? Okay, here. So the answer for that is this one is the radius, this is the ulna. Okay, this is the pisiform bone. Okay, so between the radius and the other carpal bone, this is the radiocarpal joint space or the radiocarpal joint. Okay, this is the radiocarpal joint space. Okay, and here near the pisiform bone, you see the pisiform recess. These two normally communicates. Okay, the pisiform recess and the radiocarpal joint space normally communicates. So the significance of this is, so what is the significance? The significance is that if there is any excess fluid, in the pisiform recess, okay, if there is excess fluid you're seeing on an MRI in a pisiform recess, it's not abnormal. It's not abnormal if there is radiocarpal effusion. Okay, look for radiocarpal effusion. If you're seeing radiocarpal effusion, this excess fluid in the pisiform recess is not abnormal. Okay, then the next significance is for wrist arthrography. For wrist arthrography, either of these, either pisiform recess or the radiocarpal joint space can be used. Okay, so now since we are talking about joint spaces, let's see other important joint space from where MCQs are commonly asked in the body. Okay, one is the famous glenohumeral joint space and subacromion bursa. Do these communicate? Normally, they don't. They don't normally communicate. And if it communicates, then that means there is rotator cuff tear. There is rotator cuff tear. Only when there is rotator cuff tear, it communicates. Okay. And next is the ankle joint and the peroneal tendon sheath. Peroneal tendon sheath. So normally do these communicate? So normally these also don't, no communication is there normally. Okay. And if there is any communication, that means there is tear of calcaneofibular ligament. There is tear of calcaneofibular ligament, then only there is communication. Okay. Then the next is Achilles tendon. And posterior subtalar joint space. So this one also doesn't normally communicate. Actually, this Achilles tendon does not have a true tendon sheath here. Okay. And last but not the least, it is the pisiform recess and radiocarpal joint. So this is the only one that normally communicates. It normally communicates like what we saw before. So pisiform recess and the radiocarpal joint is the only thing that communicates. Okay. So now let's see what is known as vulnerable theory, vulnerable zone theory. Vulnerable zone theory. Okay. So suppose this is the ulna, this is the radius, and the carpal bones are here. This is the joint. The important carpal bones only. Okay, so this is the lunate, this is the scaphoid, triquetral, and the pisiform. Okay, so in vulnerable zone theory, there are two flavors. It comes in two flavors, they say. One is the dislocation comes in two flavors. Okay, whenever dislocation you're seeing, it happens in the two areas. One is, this is the lesser arc that is around the lunate, but it does not involve any bones. It's completely through an area of ligament. Okay, that is lesser arc. And next is the greater arc. In greater arc, you can see it involves the bones also. Okay, and this is the lesser arc. And so the greater arc and the lesser arc. So in greater arc, when bones are involved, it is named by, first you mention the name of the bone, the main name of the bone that is fractured, followed by, preceded by trans, then name of the bone that is fractured, then you mention the dislocated bone. For example, whichever bone is dislocated, that is how you will name. For example, transcaphoid perilunate dislocation. Okay, so here the fractured bone is the scaphoid and the dislocated bone is a perilunate dislocation. If you have read, it's a type of dislocation. Okay. So it basically it involves the bones around the lunate. Okay. So it is a type of dislocation. So you mentioned what type of dislocation is there. There are 4 types of dislocation. So perilunate dislocation is one of the types. So you actually you don't mention the bone, you mention the type of dislocation. Okay. But you mentioned the bone that is fractured first. So here, this is the scaphoid is fractured here. Okay. So another important area is it comes around above the lunate. Okay, this area. It's called space of. I am not too sure about the pronunciation. It's a French term. You can Google for it. It's a little difficult to pronounce. So this is a vulnerable or a poor ligament-free area. This is a ligament-free area. That is a site of weakness, ligament-free area. And it's a site of weakness. So it is a site of weakness. Okay. And another thing you need to know is avascular necrosis of scaphoid is called what? And avascular necrosis of lunate or lunatomalacia. What is it called? This is skin box. And avascular necrosis of scaphoid is Reiser disease and Keen box disease. Okay, so that is it.